Good morning, everyone. I'd like to welcome you this morning to TLC Academy. This is Alan Susi, Director of Nursing speaking, and with me today I have Sharon McCarthy, one of our fine caregivers, who's brought in some information today that's going to help us take a look at how we relate to each other. Specifically, we're looking at the ideas of how do you avoid conflict in your interpersonal relationships. And we're going to look at that both personally and professionally. So with that, I'm going to turn the floor to Sharon and let her proceed with telling us what she'd like us to know today. Thank you, Sharon, for being with us.
Good morning. I'm glad to be here. Getting along with others personally and professionally is a social skill that is often learned growing up in our family of origin. Hopefully we learn these skills as well when we get older and interact in different situations through our schools, workplace, friendships, etc. We learn what to do and what not to do as far as appropriate behavior. We learn through trial and error. If we are aware of the correct social skills that bring about harmony and peaceful outcomes, then we are ahead of the game. However, far too often these are not always apparent in one's life, so it makes it difficult to have productive relationships. What are some of these social skills? To begin with, diplomacy works well. Accepting differences, communicating clearly, encouraging others, participating equally, listening actively, disagreeing politely, resolving conflicts, not holding on to. Treat others as you would want to be treated with respect and consideration. Compliment rather than criticize. A good relationship with people is built on 3 values: trust, the ability for people to rely on each other; respect, the condition of 2 people valuing each other; and empathy, experiencing someone's feelings as if they were your own. Dealing with difficult people. Let's talk about that. There are always going to be difficult people that we need to deal with. Do not enable complainers. Keep a positive attitude. We do not have to be rude, but we can politely change the subject. Gossiping can be toxic, so try to see the other person's perspective and not initiate any negative conversation about others. Resolve to let go of anything that is not productive in a relationship or at work. But try to see with a different perspective. What did I learn from this? Laugh at mistakes and try to do better the next time. Smile more. It creates positive energy and makes us more approachable. What usually causes conflict? Conflict and resentment usually arise from fear or hurt feelings. Different personalities, varied work styles, stress, misunderstanding, misinterpretation, sniping, inability to communicate kindly in a way that enables work to get done properly. Sarcasm, impatience, and unkindness with others are counterproductive. Excuse me. It eventually takes a toll emotionally and physically. Learning to work with different types of personalities in our relationships, friendships, and in our work environment is very important. As a caregiver, it is essential that we be flexible and kind in our approach with clients, not rigid. Everyone is different in their needs and understanding of life, so we need compassion. Look at from another point of view. Respect, consideration, kind words, and actions is often all that it takes to change one's opinion. It's important to communicate honestly and face-to-face. Respect others' feelings about an issue. Let go of transgressions, real or imagined. It often takes time to get past hurts, it's true. We need to be patient with ourselves and not be so quick to give up. I will share a quote from Alexander Kay. Use the power of charm to create a charmed life for yourself. That does not mean that we cannot be assertive, but we can do it in a way that's not offensive, not aggressive. It is also important to take into consideration that sometimes professionally, personally or otherwise, when we are interacting with someone who has dementia, Alzheimer's, or brain disorder, or sometimes we are dealing with others who are mentally ill or perhaps have addictions, we are faced with a whole other set of dynamics in their responses. When we use these skills in getting along, it may lessen the chance of things becoming explosive, and that makes it easier in general. Remember to try not to take others' responses or behaviors personally. We never know what hardships others might be facing. I would also like to summarize 10 tips for resolving conflict by Joyce Martyr. Whenever we are in conflict with someone, there is one factor that can make the difference in damaging your relationship or deepening it. That factor is attitude. Pause and get grounded. If your feathers are ruffled, it is best to take a moment to regroup rather than knee-jerk reaction that you might regret later. Zoom out to get a different perspective. Are you really upset about the issue at hand, or are you displacing your anger? Become mindful of your nonverbal communication. Facial expressions, hand gestures, and body language. Are you sending conflicting messages? Avoid behaviors that add fuel to the fire. Physical or verbal abuse is never acceptable. Criticism, insults, contempt, nonverbal hostility, and defensiveness. Reflect empathy, the ability to show that you understand the other person's feelings. It is a very powerful communication tool. Take responsibility for yourself. Save everyone time by owning up to your own behaviors. This is not a weakness. Rather, it demonstrates awareness and integrity and will likely expedite successful resolution. Make sincere and timely apologies. Use assertive communication. Avoid being passive, which is weak in setting boundaries, or aggressive, which is hostile or entitled, or passive-aggressive, which is acting through indirect hostile behavior by slamming doors or eye-rolling and such. Use I statements, not you statements. I feel, not you did. Stay in the present and do not dredge up old issues from the past. Avoid blaming. Be open and flexible. Listen and really hear the other person's. Consider the other person's perspective. Look for solutions and compromise. Focus on what you control and let go of the rest. Author Wayne Dyer wisely said, how people treat you is their karma. How you treat others is yours. Or how you react is yours. We can advocate for ourselves and hope for successful outcomes, or we can change relationships sometimes by ending them if resolution cannot be achieved. Forgive. Nelson Mandela said resentment is like drinking poison and hoping that it will kill your enemies. Recognize that people come into our lives for a reason, and even negative experiences are opportunities for growth. Be grateful for the learning experience, work towards acceptance, forgive and let go of the past, and consciously choose how you want to move forward. Finally, it is not always easy, but it's best to keep an open mind and try to be considerate in our interactions, because we never know what someone else might be dealing with and the struggles, as we said before, that they might be facing in their own life. And that's where compassion comes into play. Thank you.
Thank you, Sharon. That was very well put together.
Thank you.
I'd like you, if you could expound a little bit upon the displacement of anger. Can you talk about that just a little bit as to what you think that is when someone displaces their anger?
Well, often if something is happening behind the scenes before you've left for work or before you're interacting with someone and there's something going on in your own personal life, you're frustrated, you haven't talked about it, you haven't expressed your feelings. So when something then happens and you're presented with something at work or even socially, we may respond in a way that's not appropriate.
Okay. Is that the same thing as like projecting your anger?
Yeah.
Yeah.
I would say, definitely.
Okay. You're putting,
and that happens often.
yeah, we don't want to take ownership of our own power, and that comes out of that anger, and try to keep it under control, so we put
Right.
it out on somebody else.
Well, often we're not even aware of it.
That's a good point.
Which is why it's so important to when I was summarizing what Joyce had to say here, she gives some examples about you're driving down the street and someone cuts you off and you start reacting with a hand gesture, you're very angry, you're very aggressive, when really what's going on inside is that you just left your home and you had a disagreement perhaps with your wife or your husband or whatever, or at work something happened, which is why it's so important to express things face to face. You know, like if something does happen, it's very important for us to empower ourselves and be assertive in what is happening in our life, and we need to discuss things. And that is a whole different thing than being aggressive, as we talked about. Aggressive is anger and blaming, and assertiveness is taking care of yourself and speaking and making I statements, not you statements, not blaming. Yeah.
It's interesting too. I like the idea of stepping away or removing yourself from a situation, even if it's only temporarily, to bring yourself back together again before you proceed with a conversation or you return to whatever conflicting situation you were in. A lot of the times I have not given myself the permission to walk away from something which was toxic.
Yeah.
I've stayed and dealt with it or tried to deal with it and didn't succeed in some cases. So the advice in this presentation is, you know, granting permission for a person to say, look, this is hurting me too much right now. This is going to interfere with my ability to communicate. This may all be internal dialogue, but it's okay to have that conversation with yourself and then to say, I'm leaving right now. And you say to the other person, I am not able to handle this at this moment. I'm leaving now to calm down, and I will come back and we'll continue later.
I need to take a breath.
Yeah, or something. I mean, you phrase it whatever way it is.
Take a deep breath, and I'll be back.
Yeah.
When we can discuss this civilly. Yeah.
Because it actually impels or imposes upon the other person the same effect, that they then are alone. They don't have anybody to have this disagreement with anymore.
And they have to think about what they're doing,
right,
what they're saying.
Right.
Correct.
Yeah. So that's that's good advice.
Often we don't give ourselves the time to do that, and that's very important. Yes.
I guess it's self-explanatory why gossip is toxic, but would you just expound on that a little bit from your experience? You know, situations you may have had, or you know, some that you've witnessed where just maybe give an example or two of outcomes of gossip that you've witnessed.
It's totally toxic, and it really exacerbates, you know, situations rather than bringing them down a little bit, you know. Sometimes, like if someone is talking about someone else, and then you go and you tell someone else what they've said, and then that person will go back, and then sometimes people will even go and tell the person that's being talked about what's being said. Well, now why do that? Because that's only causing more conflict.
Right.
It is poisonous in a work environment, and it all too often happens, you know.
What advice would you give to caregivers who receive gossip from a client?
About another caregiver?
Yes. How can they best address that in your mind, in your opinion?
Well, and Joyce makes reference to that in her How to Handle Conflict, to change the subject.
Change the subject. So redirect the conversation.
Not feed into it and change the subject.
Yeah, and you don't really even need to say to the client, you know, I'm not inclined to talk about that, or
No.
I guess you could. You could simply say, well, you know, that's not something I wish to discuss with you.
Well, I think if you say something like that, especially with the elderly, they would take offense.
Okay. So you're saying
So
just
I would
redirect
just
the
change the
conversation.
subject, or thank you for telling me that.
Very
You
good.
know, and just change the subject.
Yes, that's good advice, because it's quicker and simpler, and
And oftentimes they forget anyway. You know, they'll forget. Some people are just very, they're not very kind in their way of thinking about life or other people,
Yeah.
or, you know, and they don't respond. And so we need to take that into consideration. I mean, this is the human condition.
it is.
So we need to take that into consideration. I think often we need to change the subject, or just, I mean, if it's really something that they're very concerned about and really pressing, well, thank you for telling me that. But then that doesn't mean that one has to go to someone else and repeat that,
Right.
because that's only, you know, putting fuel to the fire.
I would.
And that causes a lot of problems, because often things are not truth anyway.
I don't disagree with you. What you said is true, and I wouldn't think that a caregiver would want to take that to somebody else and repeat it.
Well, that happens a lot, though.
However, I think it could be said on the part of the caregiver to a client, this seems something that is really important to you and is troubling you right now. Have you considered speaking with the case manager concerning this matter? I would urge the caregivers to think of it that way, that they don't have to resolve it, but they can pass it on to the person above them in the stream of TLC's authorities, so that maybe a conversation privately with the client could occur to address whatever issues she has about this particular caregiver.
Do you think that, well, when you're talking about gossip, are you talking about something that she's unhappy with the caregiver?
It might be.
Or is it
Yeah.
something that she's just criticizing the caregiver?
Either
If
or.
it's criticism, I'm not sure that, I think it's very important if there is a concern that she could take it to the case manager, but then there's also other things that are just petty.
Well,
And does
yeah.
the case manager's time need to be taken up by some of these small little petty things?
Not necessarily, but if it persists and
Yes.
caregivers are confronted with it routinely on the
Yes.
part of their interactions with clients, then I say yes, they would need to bring it to the case manager for a private conversation to simply say, this is what I witnessed every time I've been with this client.
Always,
Yeah.
always,
Yeah,
because then
good.
it can get out of hand. This is very true.
This is good.
But that's different than taking it to other caregivers.
Oh, yeah, absolutely. There's no question about that. I
Right.
think that's the wrong thing to do.
I think it's very important, as you just pointed out, keep it private.
Yeah.
And say, thank you for telling me that, and maybe this is something that you need to bring to the case manager. But then leave it there.
Yeah,
Not go and tell the next person that comes on for her shift,
exactly.
right?
Exactly.
And I don't know whether that's something that needs to be written in your notes either.
Yeah, it probably should not be,
Right.
because those notes are available for
To
the client
everyone
to look
else,
at, and anybody else
exactly.
who looks at the document.
That's my point.
Family members or other people.
Yeah.
So yeah, absolutely, that should not be documented.
I
in
know of
notes.
situations where things have been documented like that, and that just causes a whole,
Absolutely.
so, good point.
Well, Sharon, I feel like I've been satisfied today by your presentation for myself. I hope the viewers of this video will also be satisfied with its content and take it to heart. There's nothing more important than how we communicate with the people we care for, because all things we do for them are subject to how they see us, hear us, and feel us. So
Very
those are all part of our resolutions of conflict, as well as keeping personal relationships healthy.
Right,
So I'm so grateful you came today and shared with us.
Thank you.
Appreciate it.
thank you.